The views and opinions expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Welcome to Generations Radio, where the focus is on our seniors and their families. We are here each Saturday afternoon from 5 until 6 p.m., bringing you resourceful information with our radio team of professionals in the field of aging. Stay with us for the next 1 hour as we explore different ways to make life more exciting and meaningful for our extraordinary seniors. Right here on AM 690 The Answer. And now, here is our host and the publisher of Generations Magazine, Percy Ihara.
Okay, and welcome back to Generations Radio. I am Percy Ihara with Melissa Mansfield from Ultras Medical. So this is on airing last week in November, so hope you had a good Thanksgiving, Melissa, as well.
Thank you.
And so what are you guys doing for the holidays?
We are laying low this year because we just put in a kitchen. And yes, so financially we have to lay low, let's just say that. But I'm so super excited about today's guest. My mom just turned 65, and I helped her with signing up for Medicare, and thanks to Martha, because I watched one of your videos on YouTube. And I actually sent her the video. I was like, she's the guru, you have to watch this. So I was able to help her.
Funny.
Good.
Thank you.
So today we wanted to have Martha Khlopin, our Medicare specialist, come on back on the radio show because the Medicare enrollment period for 2016 is December 7th, right?
That's
like
right.
A little over a week away, a week and a half away, right?
That's right.
Right, for most people. But I want to do an update. So this is the Medicare update for 2016. So the plans are out now. People are doing workshops. There's commercials every day. In the paper, there's ads every day. How are you doing? I'm glad you're able to come here because I know you work 24/7 during this Medicare enrollment period, right?
Yes, I do. And I got wet in the rain today, so my hair is also suffering. But it's been a very, very busy season. And because there are a lot of changes going on, not just on this island, but also on the neighbor islands as well. So I want to just thank the Maui Economic Opportunity Center for flying me out to Maui to talk to the residents there who saw a 402% increase in their Medicare premium for the health plan they belong to. 402% increase.
When, I mean, how did that get? I don't want to turn 65 now. How did it do 400%? I mean, what did it go from?
Well, the plans every year, a lot of people don't know. There's many different types of Medicare plans, but with Medicare Advantage plans, the health insurance companies actually have a contract with Medicare, and each year they determine what they think the cost will be to administer the plan for the Medicare beneficiaries. And then Medicare has to approve the premiums and the cost sharing. So on Maui and also on the Big Island, it was determined that it was going to cost a little bit more for the health plan there to take care of the Medicare beneficiaries. So that premium for one of the plans there increased by over 400%.
So when you say Medicare Advantage plans, because Melissa and I are not 65 yet.
No,
and I'm
not even
that
close.
than her,
I did my research, though, with my mom turning 65.
Yeah, so Advantage plans are what now? I can't remember now. For our people who are listening especially, what's the difference between an Advantage plan and a regular plan and an old plan and a new plan?
I always enjoy, Percy, that question, what's the difference? Because a lot of people don't think there's a difference. But there's original Medicare, which you qualify for at age 65 or due to a disability. And that gives you Part A, which takes care of those inpatient hospital benefits, and Part B, which takes care.
So A, there's no cost to that, right?
Well, for most people who have been paying to the system for 10 years or married to someone. That's correct. Yeah. Okay. And then the Part B is for doctor visits, lab work, MRIs. So that's your original Medicare Part A and B, which you earned or, you were working and you're entitled to if you meet requirements. And then,
so you don't pay for that one either?
No, there's a cost for Part B. Okay. Yes, there's a cost for Part B. And the interesting news for 2017, everybody's been calling me Martha. Have you heard anything about the premium for people turning 65 or enrolling in B in 2017? And I finally have the number. $137 per month is the standard amount.
Wow. For Part B.
Part B only.
Well, now you said something that I'm pretty sharp and I don't hear as good as I used to. But you just something that perked up. You said when people apply in 2017,
Correct.
what about if they apply this year?
Well, for this year, the standard amount was $121.80.
Okay, so if they're already 65, right? Because they can't apply if they're not 65 anyway, right?
Well, disability, people who
Well,
have
yeah,
disability
yeah.
qualify,
Well,
but
this is-
for age.
So if they apply by December 7th, which is the cutoff date.
By December for Social Security. So we're talking about two different things. You first sign up for your Medicare based on, whatever your qualifying event is. But with the Medicare Advantage plans, that's where you come into that deadline of December 7th.
What's the Advantage plans?
The Advantage plans.
Okay,
The
so
difference.
like I said, you just said December, people that go on Medicare in 2017.
Right.
So it's actually higher next year than
That's
was now.
correct. $137 is the standard amount. So $121.80, the standard. And I say standard because Part B premiums are income adjusted. And for the first time the last few months, I keep meeting people for whatever reason, I guess it's a good reason, their income is above the limit, and they are paying $170, $200,
month.
even up to $300 a
Wow.
month just for their Part B premium.
Are they still working?
Yes, they're still working.
Okay.
Absolutely.
But if they're still working, wouldn't the company pay that?
Why would the company pay for your Part B
don't know.
premium?
They're nice. I don't know. I just thought you worked for a company, they would pay, or they would pay a portion of it. No.
I'm not aware of any companies who pay for active employees their Part B premiums.
Really?
As a matter of fact, I do think that might not be legal.
Really?
Because you might be encouraging your employees that qualify for Medicare to go on a Medicare plan instead of the active employee
Company
Plan.
plan.
employer
plan.
group plan. So I think that may not even be
Well,
legal.
a lot of people
personally.
do, right? A lot of people. I'm golfing with a couple of buddies of mine next week, and they're 68 and 70, and they're very healthy. And they told me they're not on the Medicare. They would take the company plan,
Right?
but then they would still need to sign up for Medicare A.
Well, it depends. If you work for a company that has less than 20 employees, Medicare is supposed to be primary, even if you're working and covered under a group plan. So in that case, Medicare would be primary and your group health plan would be secondary. So it is important for certain people, if you work for a company with less than 20, you do need to sign up for your Medicare A and B, even if you are covered by a group health plan.
So you said just now. I said so you would take the Medicare A and B, and your company insurance would be secondary. What does it mean by secondary? Will cover the
That means
balance.
pay second. Pay second.
What do you mean by pay second?
Well, let's just say your group health, your original Medicare covers 80% of your
Right.
Part B costs.
Okay.
And you normally would be responsible for 20%.
right.
So if you have an employer plan and that plan pays secondary, original Medicare will pay first, and then the rest of the claim will be sent to your group health plan, and they should pay the 20%.
And they should pay the
difference.
20%.
Sure.
I get it.
As long as it's a Medicare approved procedure. For example, if you want a tummy tuck and original Medicare doesn't cover that, then I don't think you should look for your employer health plan to cover that either. So it's only
I had thought about
Medicare.
liposuction, by the way. I'm in pretty good health, except for my stomach. I just can't get rid of the stomach at my age. It's just too hard.
okay.
But okay, so that's interesting. But one thing you mentioned early on, and I've noticed for years, that the Medicare programs on the neighbor islands are more expensive.
Yes, that is true. They are more expensive.
Is there a higher acuity on the neighboring islands?
Well, when you think about how many residents are here on Oahu versus the neighbor islands, so you can spread the costs, right?
Okay. Yes.
Across more people, more lives than here, than on the neighbor island.
Now, does it vary from island to island, or just all the neighbor islands? Does
Well-
it differ from one island
Well,
like Hawaii,
would,
Maui, Big
I would
Island?
say what I've seen in the premiums is they've been consistent. So they have a plan, and the premiums will be similar on all the islands there. I don't see any fluctuations like only Lanai City or only Molokai. The neighbor island plans are pretty consistent.
So it's more population rather than acuity.
Yeah, I would say, because I don't know exactly what each health plan has put in there, we call it a bid to Medicare. I can't really say why we see such a,
Increase.
exactly why we see such an increase between Oahu and the neighbor islands, but I do know that it happens.
So we're here at Martha Khlopin, our resident Medicare expert. Now, you do have your own radio show still?
Absolutely,
And
I
that
do,
airs
Percy.
again, Martha, Medicare Moment with Martha?
Yes.
And when does that air?
It
Saturdays?
airs on Sunday at 9:30 a.m. in the morning when football doesn't kick me off and make me go earlier.
Yeah, kicked off our show last week, by the way.
Yeah, and also people hear me on KGU 99.5 FM at 2 on Saturdays.
Oh, really?
Yeah.
Okay.
Yeah.
So here's about Medicare changes for 2016. So what else is going on? With any other changes have you seen?
I think one of the big changes a lot of people are adjusting to is if you are in the military and you turn 65, you're retired, you have TRICARE for life, they actually require you to get Medicare Part A and B, because when you're turned 65 and qualify for Medicare, TRICARE for life will only cover you if you have Medicare Part A and B. So I am hearing from a lot of retired veterans who are really surprised. And so I've been able to assist them get their A and B, because in some cases, your identification, which you use for your healthcare benefits, it doesn't get renewed. So I had one person say, "Oh, I got to get my Medicare to renew my ID," and I said, "Really? Your Medicare? I don't understand the relationship." So they explained to me that that's the card that they use for their medical benefits. So they needed to get their Medicare A and B in order to get that renewed. So that was something new for me, and that's what I love about Medicare. I learn something new every week, I would say, because of the questions that I get.
So TRICARE would be their primary, and then Medicare would be their secondary?
No, actually, original Medicare becomes primary for retired military, and TRICARE for life is secondary.
Oh, interesting.
Yes, and a lot of people, don't understand too. The other one that keeps coming up, we do have people who are seeing these commercials, both on the television and on the radio.
Tons of them.
Join the plan, join the plan. But if you are an EUTF retiree, Employer Union Trust Fund, if you work for a city, state, county, and you qualify for EUTF retiree benefits, you need to go through EUTF and not sign up with one of the, I call it off-the-shelf plans. So I have heard from people. I had this one person in particular that I'm thinking of, and it was actually a couple, and the husband was getting close to 65, and he got something about signing up for a Medicare supplemental plan and a separate drug plan. So he signed up. He thought that was the right thing to do. And it just so happened they came to see me. They were referred to, talk to Martha before you make any final decisions. And they mentioned to me they were both EUTF retirees. I said, okay, let's call EUTF right now. We called up EUTF benefits folks. They're very, very helpful, very knowledgeable. And they said to this gentleman, they said, we need your Medicare Part A and Part B card. Send that to us, and absolutely disenroll from that other plan, because if you do not send us your Medicare card, you will lose out on the EUTF Medicare benefits. So EUTF signs you up for your Medicare plan once you qualify for EUTF retiree coverage. But some people don't know that.
Yeah.
They see the commercials. They feel they got to do something by December 7th.
You might get penalized.
Exactly. So no, if you're an EUTF retiree, if you've gotten mail from them, open it and call EUTF retiree benefits consultants. They are fabulous.
So that's like a nonprofit. That's a one place people can go.
It's the one place that's
state,
set up.
City, federal employees.
No, federal has their own separate plan.
State and city.
This is state, city, county.
That are retired from
teachers. Yeah, and they can call to see if they qualify for retiree benefits. I even had a person on the Big Island call, and her situation was her husband is younger than she is by 1 year, so she thought he had to go on one of these Affordable Care Act plans.
Yes.
Because she hadn't retired yet, so she's getting close to retirement for her EUTF. So she said, Martha, I'm going to be contacting EUTF for my retiree benefits, but my husband was on an individual plan, and it was $400 for 2016, and it's going up to $800.
Wow.
Doubling. I was like, what? And I said, well, doesn't he qualify for your EUTF? And she said, oh, I don't know, does he? So I said, let's call up EUTF because, I specialize in people not saying, I did this because Martha said, because
Right.
I don't want any trouble. So I always encourage people call EUTF, call Social Security. You want to make sure you call the right agencies so you get the correct information. And whenever somebody sits down to talk to me, I always call with them if I need to, so we get it straight from the horse's mouth. But what I do help with is framing the question. So we called EUTF for this individual, and she learned that her husband would qualify to be a dependent under her EUTF retiree plan. So they still will have some kind of a premium, but it's not going to be $800 per
Right,
month.
double.
So just making a phone call, she called me and we were chatting, and she said, "Oh, his premiums are going up by half, by double." I said, "Let's call EUTF," and so we were very successful in helping her find out that her husband actually did qualify for coming under her plan.
But do a lot of people change plans? I mean, I'm in HMSA, and a lot of times people will go with the HMSA Medicare plan, or they have an Advantage plan too, right?
They have an Advantage plan. That's correct.
But would people just stay with HMSA or Kaiser or whatever?
That's a really good question. And what I find, people who are in the Kaiser system, they really do like being in the Kaiser system. They don't have to go out and find doctors who are accepting new patients. And Percy, that's a really good point to bring up, because when a person sees each year around this time exactly what the benefits will be for 2017 and what the premiums will be, if they're in an HMO or Kaiser's system, they may think, let me change and go to a different type of a plan. But what they fail to realize is, even though a plan may have a list of providers, sometimes those doctors, those providers, their panel is full. So even though they take another plan, they may not be able to take you because they are full. So I really encourage people, before they change plans, really think through the fact that they'll have to go out and find a new PCP, personal care physician, new specialist. Don't just make that decision. I mean, of course, premiums need to be affordable, but don't just make the decision because you feel maybe angry or upset that your premium is going up. The key is, when it's time for service, you need to know what to expect. You need to make sure your doctors are there for you, and you can be taken care of in the way that you've come accustomed to being taken care of.
Well, because I know a lot more doctors retiring. I have a relative retiring because they don't want to keep on all these changes, and they don't want to deal with all the Medicare rules like that. And so a lot of doctors aren't even taking new patients, right?
A lot of that's what I hear, that a lot of doctors are may not be taking patients, and it could be for a number of reasons. Maybe as they get older, they do want to reduce their patient load. So again, their panels are filling up a lot sooner than maybe they would have when they were younger. So that's why it's really important for people, before they make a decision. I cannot tell you how many times I've told people, maybe you want to stay with the plan that you have. And they're always really surprised, because I have an agency and I have agents, and that's how, I can support the business. But for me, it's very important to me that when it's time for service, that person gets what they expect. So if you change plans and then you can't find doctors, that's not going to be good for anyone.
I know personally, I have probably changed doctors. I've been here for 12 years, and I have gone through probably about 6 doctors, because I need to feel comfortable with them. I want them to listen to what's going on with me, and not just prescribe a pill to make me feel better. I really want them to get involved. So it's something that I finally found a doctor that I can trust and that I can grow with as well.
Exactly.
So I think that's so important than just, it's important to save money, but you can't find that doctor that you have that bond with. It's not as easy.
Melissa, that's such a good point. And I think that's exactly my point. When people pick up a booklet and it shows a doctor's name in a booklet, or you go online, but you really almost need to make sure that once you make an appointment, that doctor can see you and you have that rapport, and you want to be able to easily change doctors if you need to. So I think that's a really good point. And with Medicare, I have to say, another thing that comes up a lot with Medicare, when people have employer group health plans, you go pick up, your doctor writes your script, you go pick up your medication, no problem. But with Medicare Advantage plans in particular, they have a formulary. And that formulary tells you what drugs are covered. And if the drug is not in that formulary for that particular company, then you may end up paying more for medications than you ever could have expected.
That's what's happening to my mom now.
Oh, okay. All right. Okay. Yep. You have to know that the drugs are in the formulary. I had a gentleman who was signed up for a Medicare Advantage plan by someone very, very experienced, but I guess he failed to tell her what medications he was on, and she assumed that he didn't take medications.
Yeah.
And so he called me about a month ago, and he said, Martha, he said, I'm looking in this book that I was given by this agent who signed me up, and I noticed my medications aren't listed. And I said, oh, well, what are they? I'll just, look at them for you. So there's a great tool on the Medicare site, medicare.gov. Very great comparison tool. So I put the medications into the tool, and I put the name of his plan into the tool, and we determined that the cost of his drugs would be $8,002 a year.
Wow.
So I sent that to him, and I said, you might want to talk to your agent about another drug plan, and you need to let the agent know what medications you take. So that's the other challenge that I see out there sometimes when people feel they've been put into the wrong plan. The Medicare beneficiaries need to understand you have to tell the agent that's working with you all of the medications that you take, the primary care physician you see, any specialist that you see, because a primary care physician copay is different than the copay for a specialist. So these are just some of the little nuances that I think that I remember, Percy, when I did the aging in place, I brought a blouse in and I said, hey, everybody, this blouse looks like it would fit me. And of course, everybody was very polite. And I said, yes, it does. And I said, but when I tried it on this morning, I couldn't even get it over my head. And I said, we don't want to be that way with our Medicare insurance. We don't want to find out when it's time for service that the plan doesn't fit. So it's a really good idea to sit down with someone, and I do it, Percy, as you know, as Percy, you beat me up, you might want to beat me up on this. As a community service, I sit down with people and I'll go over their plan.
That's great.
And if it turns out they need to stay with what they have, they stay with what they have. So I'm interested in growing a business, over time, but really making sure everybody that comes through my door has the plan that they deserve.
I love that, because that's what's really important, because, currently right now people are so overwhelmed. There's so many plans. They don't know where to go. So to have that specialized one-on-one attention, I think is extremely important.
Yeah. So you're in the thick of it, almost winding down
Yes.
to the end of Medicare season. So what are some of the things that you're seeing? Are there more popular questions than other questions? What's the atmosphere like out there with people coming to you and the questions they're asking you, and how is this process going?
Percy, what's happening out there right now? Fear. A lot of people,
Fear?
Yeah, fear. A lot of people who have Medicare are very worried about what Medicare will look like under the new administration. Thank you. Under the new administration. And I feel pretty encouraged and positive. I think that a new administration certainly wants to take care of a large part of the population. And even here in Hawaii, we have over 224,000 Medicare beneficiaries. So I think that the program will be okay, but there's a lot of fear about changes in the Medicare program. There's a lot of changes, a lot of fear. People feel the doctors don't want to take Medicare anymore.
Yeah.
And then I'm starting to hear, believe it or not, from the generation in their 40s, they assume there will be no Medicare when they're 65. So,
yes, I have that fear. Not so much a fear. I know that change will probably come. It might be more privatized. Perhaps that might be something that's what my thought that this new administration might consider or look at.
Right.
But I hope that it will be, because I think it's a good benefit for a lot of seniors. So
yeah, Medicare's a fabulous,
a wonderful benefit that we, and that we pay into.
Exactly.
So I hope that I do get to see it when I turn 65.
Right, but it's a lot of fear out there, and I think Percy, December 7th is one of the enrollment deadlines for people, and I think a lot of people aren't making any decisions because of some of those fears. And I was with someone, just today at the elderly center, and she said, Martha, I want to change. I want to look at other plans. She said, but I'm so afraid, because I think if I make a change that my doctor might be unhappy, or my doctor might kick me out. And I said, wow, that's so sad that you can't really look at what other options are because of your fear. And I said, so, let's talk a little bit more and try to understand that fear and see what we can do for you. But what I find is there's a lot of fear out there.
Really?
I think that because we just, finished election season, there was a lot of talk about cuts to Medicare and problems like that. But I think that, again, Medicare, there's more of us turning 65 every day. 10,000 nationally are turning 65 every day. So I think Medicare will continue to be a benefit that the new administration will support.
Yeah, I think so. It's interesting you say fear, because if you just turn 65, you're going to be fearing this for a long time. If you live in your 90s, that's 25 years to be fearing something. But yeah, we'll see. I think you've done a great job out there. You educate a lot of people. And I think people, if you're listening, you really need to give Martha a call or sit down with a professional that has a lot of years of experience. Because I know there's a lot of agents out there that are not as experienced and may only want to just sell your product. And that's what I appreciate about you, Martha, is that you really do sit down and find out the whole their life and what's important to them and what's going to fit. And it's really commendable of you to do that. But anyway, we're going to take a short break here. We're going to come back and talk to Martha Khlopin again, our Medicare lady, about some of the other changes. What do you think of, I don't want to get involved in politics, but what this new administration may think. And is there still the Affordable Care Act programs out there?
It's still here as of today.
All right. Anyway, we'll be right back with Generations Radio. Aloha.
We will be right back with Percy Ihara from Generations Radio. If you have any questions or want to be part of our discussion, give us a call at 296-5467. That's 296-5467. This is Generations Radio on AM 690 The Answer.
Did you know 26 million Americans have kidney disease and most don't know it?
The day I was diagnosed, I didn't know what to do. I called the National Kidney Foundation, and the young lady who answered stayed on the phone with me and walked me through step by step. She too was surviving kidney disease, and she showed me there could be life after kidney disease.
Visit the National Kidney Foundation at kidney.org. Now you know.
Moon Physical Therapy is here to help you back to recovery. Moon Physical Therapy is located on Ward Avenue across from Sports Authority. Physician prescribed for motor vehicle accidents, workman's comp, or that body pain that comes from rushing to play without warming up. Also event cardiopulmonary rehabilitation with our one-on-one patient care. Moon's Aquatherapy heated endless pool allows for low-impact exercise with less pain on land. We will give you the right exercises to get you back to health. Ask your doctor to prescribe Moon Physical Therapy. Moon Physical Therapy. We achieve results.
Aloha, this is Martha Khlopin.
And at Harrington, choosing the right Medicare plan not only saves you money, it also helps you avoid headaches and heartaches down the road.
We want to remind everyone
to listen to a Medicare Moment with Martha, Sundays from 9:30 a.m. to 10 a.m. as we help answer important questions on Medicare so you can stay healthy, wealthy, and wise all year long.
Call me at 543-2073, 543-2073.
I was an addict from the age of 13. I finally decided it was time for a change. I walked into the Salvation Army Adult Rehabilitation Center, and that got me ready for the real world. Now, I choose to be guided by Jesus Christ, and today, I'm building a powerful and promising future, free from drugs and alcohol.
Please shop at the Salvation Army family stores. With our discounted sales, your support through your purchase helps men live a clean, sober, and productive life.
Got Vegas on your mind? Get Vacations Hawaii on the line. Vacations Hawaii offers weekly 4 and 5 night Honolulu to Vegas packages, which include 3 meals daily from $6.99. Stay at Hawaii's favorite casinos: California, Fremont, Main Street Station, and Orleans Hotel. Vacations Hawaii will get you there in comfort on deluxe wide-body 767 planes with complimentary in-flight hot meal service. Vacations Hawaii's frequent flyer program gives you future travel discounts and credits. So if you're ready to win big, call Vacations Hawaii at 591-4777 or visit pointVacationsHawaii.com.
Today, more than ever, we local people are living longer than any other state in the Union, with more seniors, baby boomers, and caregivers. Generations Radio promotes the importance to be proactive as we all age. The radio team will focus on issues facing our seniors and their families, finding resources to navigate healthy aging along with financial, legal, and caregiving information. So join Percy Ihara from 5 until 6 each Saturday, right here on AM 690 The Answer. Focusing on the issues facing our seniors and their families today. Here's our Generations Radio host, Percy Ihara.
And welcome back to Generations Radio here. I'm Percy Ihara with my co-host, Miss Melissa Mansfield from Ultras Medical. So this is December. Well, not quite December yet. Not quite December.
You'll blink and it will be here. So,
but it's a very important time where we meet with our families, meet with our parents, grandparents, to really help them. Martha, you brought up something really good. You said, you want to help your parents because if they choose a wrong plan, it ultimately is going to affect the kids a lot of times as well, right?
Absolutely, Percy. And I'm full of stories. I just had one 2 weeks ago, and a person came to me and she said her father's health insurance somehow got canceled, and we're not exactly sure what happened, but the dad was on dialysis. So they took dad for dialysis. They were asked for $4,000.
What?
Because they found out his insurance had been canceled.
Wow.
So the adult daughter in her 40s, she somehow they found their way to me, and I was able to help them with some things. But I keep telling adult children, I know it can be awkward, just as awkward as it was for your parents to talk to you about things when you were a teenager. It's awkward to talk to parents and to say, oh, what insurance do you have? Well, how does it work? Well, because they almost feel as if you don't think that they know what they're doing. And it's not that they don't know what they're doing, but Medicare doesn't work as simply as we would hope it does. You do need to get involved because it can make a world of difference. That gentleman was unable to get his treatment because even though they treated him that day, and then they said, you got to go get the insurance taken care of, but he has a gap. His insurance won't be back into effect, for another couple of weeks, actually December 1st. So he didn't want to go back to the dialysis center with no money. So he didn't get his dialysis treatment, and guess where he ended up?
Really?
In the hospital.
Wow.
So it's not only a financial burden if the insurance is not done correctly, but also it can have an adverse health, situation. So it's really, really important to sit down and have that talk with the parents to, see what insurance they have. This is the time of year that you can look at what the Medicare plans are offering for 2017. And you really should go line by line through what's called a summary of benefits to see exactly what the cost sharing will be based on the plan that they have. And I always like to, share with people, they love seeing the zero premium.
Yeah.
And the way that plans can offer zero premium is Medicare Advantage plans is the insurance company is being paid by Medicare to administer or handle the Part A and Part B benefits for the beneficiary, but there are other plans that may be more appropriate. So if you can afford a little bit more than zero, sometimes those plans work well too. Medigap, they're called Medicare supplemental plans or Medigap plans. And what they do is they work alongside of your original Medicare A and B, and whatever Medicare doesn't pick up for a Medicare approved service, this Medicare supplemental plan pays secondary. So it's good sometimes to look at those too. Right. Now you do have to get a separate drug plan with those, but sometimes they work for people, especially if you may have some chronic health conditions.
Mm-hmm.
During the first 6 months of qualifying for your Part B Medicare, you get guaranteed issue and a preferred rate. So it's really, really important that people explore all of the Medicare options that they might be eligible for and not just get so focused on what they see advertised on TV.
Yeah, I think it's you said it. It's so overwhelming. And my mom, she was so reluctant to sign up because it is so overwhelming. What do I choose? And even going on the website, I feel that she can maneuver the internet pretty well.
Uh-huh.
However, going into 3 or 4 pages, she gave up and I don't know what to choose.
Mm-hmm.
And so that's when I stepped in. I said, okay, I'll help you.
Mm-hmm.
However, it's like you said, starting that conversation and saying, I don't want to take over her life, but yet I want to step in and be that support system.
Right.
But then the adult children need to understand what they're looking at as well.
Exactly. And also, I want to say in support of Medicare Advantage plans, it's important for people to look at something called this financial protection or maximum out of pocket. These are terms that we're not accustomed to hearing with our employer health plans.
Mm-hmm. Yep.
So this is like a whole new language, but that can be a very, very important benefit as well within the Medicare Advantage plan. For example, somebody earlier was talking about, they think their parent chose original Medicare. With original Medicare, when you go in for service, Medicare pays a portion and then you have a cost share. So that keeps, if you have $15,000 worth of services, then you'll have the cost sharing that applies to that. With some of the Medicare Advantage plans, they cap what you would have to pay out of pocket. And if you meet that maximum, then you don't have to pay for service for the rest of the year. So there are some financial protections built in to Medicare Advantage plans, Medicare supplemental plans. But again, because it's all new terminology and it works so differently than employer group plans, I understand why people, can be reluctant. And then a lot of people, they just don't like the idea that they turned 65. Like, when did that happen? I was just 40.
What happens if somebody signed up already? This is going to be the last week of November, and the cutoff date is December 7th. What happens if they sign up already? Can they change their mind, or is there like a grace period? Or
That's an excellent question, Percy. And yes, they actually can change their mind. Medicare will look at the very last application that was submitted. So even if you enrolled already, if you're unsure, if you said, oh, that was the wrong plan for me, you can still look at other plans and you can still enroll by December 7th, and Medicare will take that last enrollment application as the one that you wanted.
So let's say on December 7th, you finally changed it a third time, and then December 8th, you go, oh my God, I got to change it again, or maybe January 1st. Is there like a 30-day window or no window?
Do you get penalized? You have to wait for the next enrollment?
Not for a Medicare Advantage plan. Now, there's different enrollment periods. So for most people, they have that December 7th cutoff, and that plan becomes effective January 1st. But there are other people who have what they call Medicare savings programs, like extra help paying their prescription drugs, or they qualify for state Medicaid, called Quest Integration. They actually can enroll anytime. They're not limited to the December 7th.
Dual eligibles, they call
the
that?
dual eligibles,
that's
why.
for Medicare and Medicaid.
Exactly. So you see why it's so difficult sometimes to talk about Medicare, because there's one deadline for some people, that's December 7th. There's another deadline if you have Medicaid or you have extra help with prescription drugs. And if you're just imagine somebody just turning 65 in February. They don't have to wait until next October through December. And believe it or not, Percy, I even get people who have done that. They turned 65, but they saw advertising that said you can only enroll from October 15th to December 7th. So even though their birthday was February, they thought they had to wait. And then they can end up getting a penalty. You want to talk about penalties. So it's really important not to just look at the information that's being advertised without really understanding how it relates to your specific situation. So you can call Social Security and get information about that. And they do have
just call Martha. Martha, again, before I forget, what was your phone number again?
People can reach me at, of course, 808-230-3379. 230-3379. And Percy, I do get people who say, okay, Percy had you in his magazine, so I know I could talk to you. Or Percy said to call you.
Melissa, you got to have your mother call
and I always, she's on the mainland. So do you ever have adult children that live here and have their parents call from the mainland?
I do. And we conference call together.
Okay, good.
And again, it's really important. I recently had someone that I worked with here, and her best friend lives in Las Vegas. So the reason that she called me, she said, okay, my friend and I, we just had a big fight over Medicare. And she says she doesn't have to enroll. And I told her I think she has to enroll. And we're not speaking now. I was like, oh no. And so she said, can I have her call you? And I said, oh, of course. And the friend called, and she was very thankful to her friend here in Hawaii who kept on her case, because it turned out she was working for a company with less than 20 people, and she was required to enroll in her Medicare A and B. But she kept calling Medicare, and she works like 3 jobs, so she never had enough time to hang on the line to explain her situation. So she was unable to find out from them that she had to qualify, had to enroll. But we were able to get Social Security on the phone, and she did learn that she did have to enroll, and her birthday was coming up like the next month, so it was really good she did it that month, and then it became effective the following month, so she would have no gaps in her coverage.
Wow, amazing. Now, you had told me a story, was it maybe a year or 2 years ago, about your auntie that you were named after?
Yes, Auntie
and
Martha.
tell the story again, because it's a remarkable story, and I know it's true, but it's just a remarkable story how things work in life.
Yeah, it's so interesting, Percy. You know, my Auntie Martha lived in New Jersey. She called me, and I said, oh, Auntie, I can't talk right now. I'm about to do this radio show. And she said, what radio show? And I said, oh, a Medicare Moment with Martha. And she said, Medicare? She said, you could fill a half an hour talking about Medicare? I said, I could fill books. I could fill stadiums with talking about Medicare. But anyway, so I said, yeah, Auntie. And she said, well, she says, I just retired. She's about 75 at the time. She said, and I got my original Medicare red, white, and blue card. And she said, I picked up a standalone drug plan. And she said, I'm fine. She said, I never get sick. I don't take much medication. And I said, oh, okay, Auntie. I said, I'll call you back and we'll talk about it some more. So over the Thanksgiving holiday, that was around October. So over the Thanksgiving holiday, we talked. And I told her, why not take a look at some of the Medicare Advantage plans, because they include the drug, and some of them had premiums of $0. So she said, really? Because she was paying about $36 a month for a drug plan. So we got her signed up over the Thanksgiving holiday, and, she just went online. I just directed her, from the phone, because I'm here in Hawaii. Again, she was in New Jersey. So she had to put in her zip code. She had to put in her doctor's names. She put in her medications, and she found this Horizon Blue Cross Blue Shield Medicare Advantage plan. And again, when you sign up for a plan during this time, it becomes effective January 1st of the following year. So we signed up Thanksgiving. So every year I talk to my relatives on the mainland. I say, Happy New Year. I know they may be dealing with snow and wind and temperatures below freezing, and I'm here in sunny Hawaii. And I called her, wished her a Happy New Year. Everything was good. And generally I call them the day after, but I didn't call anybody the day after. I just called the New Year's Eve. So January 2nd, I got a call from my cousin, Auntie Martha's son. And he said, cousin, he said, my mom is, in the hospital. She had a massive heart attack and stroke. And I'm like, what? I just talked to her. And he said, yeah. And he said, she's in ICU. She's on life support. And then he said, but the weirdest thing happened. He said, I get into the hospital. He said, I'm crying. I'm looking at mom. And he said, somebody tapped me on the shoulder and says someone in the financial office wants to see you right away. And he's saying, why would they be bothering me? I'm trying to process that my mom is on life support. So he goes down to the financial office, and then there's a person there who's smiling. So now he's really confused. His mother just had a massive heart attack and stroke. They wanted to see him financially. She's smiling. And she said, Mr. Wilson, and this story I can say because it's been publicly distributed. Mr. Wilson, you are blessed. Your mom had original Medicare, which would have covered 80% of her costs, and there would be some deductibles and cost sharing. I would have needed to ask you for a check for $1,244 today.
Wow.
That's what I would have collected from you, because your mother was admitted. He said, but she joined this Blue Cross Blue Shield Medicare Advantage plan, and the out-of-pocket for this is $0. You don't have to pay anything. And it went into effect at 12:01 a.m., January 1st, and that was the day that she went into the hospital. So she told him, she said, without this, we would have had to collect money. So my cousin, he's just like, who signed her up for this Medicare Advantage? I don't even know what Medicare is. I was like, cousin did. And so, like a long story short, she did recover 100% from everything. It was really, really amazing. But throughout her time in the hospital and in the rehab, the doctors would high five her. It was the most amazing thing because everybody wanted to see the lady whose Medicare Advantage plan went into effect on the first day of the year and the day she had a stroke. Everybody wanted to just give her a high five on that because it turned out that the cost of her care, it took her about a year and 3 months to recover. Total billed was $2 million.
Wow. That's a miracle.
Yes, it's truly a blessing. And under original Medicare, she would have been responsible for about 20% of those costs and some deductibles and so on. And so we calculated it out to about 75 to 100,000 that she was able to not be billed for because she had the Medicare Advantage plan. And she also had a secondary coverage as well. So just a simple phone call, hey, Auntie, what's up? And her making a decision to change plans and one that would work well for her. She didn't know she was going to have, a heart attack and a stroke on New Year's Day that year, but she did. And praise the Lord, she was able to not have any major out of pocket. And she had, we calculated the equity in her home, and she would have been required to actually sell the home, pull the equity, and pay those bills. Because when you owe hospital bills, I'm sorry, they understand that you're sick, they understand that she was a widow, but they still need their money. So she was able to save her home because she had the right Medicare plan. She had a plan that really fit her for what she could never have expected. And so my cousin, I'm a hero, but my cousin, we were good friends growing up, and he was shocked that I'm in Hawaii, she's in New Jersey, and we still were able to get that accomplished for her.
Wow, great story. This October-November issue of Generations Magazine, which is still out today, is on veterans.
Right.
They feature 4 veterans on the cover. How does that work with TRICARE and the military when it comes to Medicare?
I just met with someone yesterday, and he was so happy that we met because he was really troubled by the fact that he needed to sign up for his Medicare A and B to keep his TRICARE for life. He just didn't understand, why that was necessary because this gentleman is still actually working. So he has coverage that's active, but he still wanted to be able to draw upon his TRICARE. So he turned 65 a couple months ago, so he did need to sign up for his A and B. So I showed him how he can go right to Medicare.gov. There's a very easy sign up if you don't have your Part A already. If you do, that's a different process. But he was able to go right onto the Medicare.gov site, enroll in his Medicare A and B. He'll have his card in about 3 or 4 weeks. He can take that over and get his new military ID card, and now his TRICARE for life will be intact. And what happens, original Medicare will pay first, now that he's 65, and his TRICARE for life will be secondary payer. And then he also has his employer coverage on top of that. So he was a really happy camper that he was able to be directed to Medicare.gov and get signed up.
That's a great story. And so what about the Part D, as in David, as in drugs? Is that changing too, or has changed?
That's an excellent question. The drug plans can be included in Medicare Advantage plans. So sometimes you get that, or you can pick up a separate standalone drug plan. At times, I have not heard of any major changes with the drug plans. It's just always important with those plans, make sure your medications are covered by the plan.
And like you mentioned, you can go on the site and enter your medication that you're currently on to see if they are covered.
Yes,
that's a wonderful
great tool. It's called the Compare tool, and you just go to Medicare.gov, and you can actually put in the drugs, put in the plan, and you're good.
Wow. But you're still doing workshops, or you're getting too close for the end of the enrollment period?
I actually have workshop in Maui today, Saturday. Saturday, I'm at the Maui Beach Hotel from 10 a.m. to 4 p.m. I'm doing workshops.
Really?
From 10 a.m. to 4. And the following Monday, I'll be at Maui Beach Hotel again. Yes.
Well, you're going to Maui a lot, huh?
This will be my 4th trip this season.
Really?
Yes, because the premiums increased. So a lot of folks are very concerned.
They have to change plans.
They don't have to. Some can't afford it, so those do have to change. So if they can afford it, I'm telling folks, stay with the plan that's working for you. But some people actually can't afford that 400% increase. And I was thinking if any of my bills increase 400%, I'd be in trouble. I might have to drop it, but you can't drop insurance.
Right.
Right. What about the Kauai or the Big Island? Have you been out there too?
I've been to the Big Island, and I do have some folks who also experienced that significant increase and are needing to look at other options. And for them, there are no zero premium options. So they have premiums that range from $194 to $202. So many of them are opting to go original Medicare and a standalone drug because they can't afford the premium to be in a Medicare Advantage plan. And there are no options for them.
So there are no Medicare Advantage plans that are zero premiums
on Big Island.
Oh, so there's on Maui and Kauai?
I'm talking about Big Island now,
Right.
just the Big Island.
Okay, so Maui and Kauai still have zero premiums?
Yes.
Oh.
Maui.
Okay, for now.
For now. For 2017.
So, with the new political regime coming in, are there any rumblings, or are we not going to wait and see how Mr. Trump handles everything? And 'cause he didn't like Obamacare. He was going to change things up. So,
Yeah, I think we have to wait and see with Medicare and even with the Affordable Care Act, which people refer to it as Obamacare. I think we have to wait and see because it does seem like he's sort of,
He's open to
backpedaling a little bit.
something. Yeah, I did read,
Yeah.
or I saw that he was wanting to keep some of the wording,
Right.
programs in there.
Right, especially children up to, I shouldn't call them children, but adults up to age 26 can stay on their parents' plan. And so I think he plans to keep that. So I think we have to really just wait and see. I think we don't know. I think he is looking at really changing some things. And I think we just have to wait and see. But like I said, I'm positive and I'm encouraged. I do pray a lot. And I think that is the key. But I do believe that, he will address some things. But I think Medicare is a very important benefit. And I think that he will do everything to protect it. I do.
and you mentioned something about the Affordable Care Act. Obamacare is still around.
Yes.
But you said interesting, you got to go online and it's cheap. You save 20-30% on a premium versus going into, was it Kaiser and HMSA?
Well, right now, those are the only two health plans that are in the Affordable Care Act. Oh, you did? Yeah.
I didn't know that.
Yeah, those are the only two.
Well, United Care, Humana, all those other plans.
Those are Medicare Advantage plans or
like Blue Cross or Blue Shield.
Yeah, no, not for
Really?
the Affordable Care Act. So you go to healthcare, healthcare.gov, and they have all the information that gives you an idea of what the rates are and so on and so forth.
So you get a discount if you go online.
So they call it subsidy. Subsidy, or you can call. They also have a phone number. If you go to healthcare.gov, you can look at the phone number and you can call and apply by phone. I've been with a couple people when they've done that. It takes about 25 to 30 minutes. They do ask a lot of information they even run a little kind of background check and ask questions that only you would know because they want to make sure that there's no fraud involved.
Sure.
But yes, if you walk into the office, they're not able to give you the subsidy. So to take advantage of the
administration
subsidy.
fee.
Right. So to take advantage of the subsidy by phone or online, and the subsidy is based on your income. So if your income is high, you may not get a subsidy. So it all depends on what your income level is. Mm-hmm.
Oh. So I want to go circle back to your original comment about Medicare and the fear. What do you do or how to calm fears, or how do you make people realize that's just part of life and aging?
Well, a couple of things I do is I give people the facts. For example, we have over 70% of our doctors take Medicare. So also I let people know that if you're an established patient, many times the doctor is not going to, because you turn 65 and qualify for Medicare, normally won't just abandon you. So I really encourage people to really be informed. And I'm big on informing them. I carry around my Medicare and You 2017 book. Yes, it's 126 pages or so, but I know exactly where to find information that is important to the individual. And I think that really helps for them to know that some of the information out there is just, it may not apply to you. So you really need to figure out what applies to your specific situation. And then I call myself, when I email people, I tell them I'm their Medicare buddy.
They got a friend in you.
Medicare buddy speaking. So do know that as a part of my community service, I'm willing to be your Medicare buddy and walk you through the process.
But anyway, we're here with Martha Khlopin. Thank you so much, Martha. Your radio shows again, which on Saturday and Sunday are?
Yes, KHNR 690 AM at 9:30 AM and on KGU 99.5 FM at 2 p.m. on Saturdays.
And what's the best way to reach you? Because I'll tell you, I know Melissa's going to get your phone number to her mother.
Absolutely.
But again, your phone number, so people, I don't want to call me. I want to call you.
808-230-3379. That's 808-230-3379.
And don't forget to like us on our Facebook page. Generations Magazine has a Facebook page. And don't forget, Sundays during college football season, there's Aging Well on the KITV News segment about 6:45 Sunday mornings. If not, no football. It's on Saturday mornings about 7:45. So thanks, everybody. Aloha, and live well.
Aloha.